Is NILM a normal pap smear result in cervical cancer screening? Imagine going in for a routine checkup and hearing that your pap smear results are NILM. You might wonder what that means for your health. Well, NILM stands for negative for intraepithelial lesion or malignancy. It is considered a very good sign in cervical cancer screening. This result shows that no abnormal or cancerous cells were found in your cervical sample. It means your cervix looks healthy at the cellular level at the time of testing. During a pap smear, a healthcare provider gently collects cells from your cervix, including the outer surface and the transformation zone, which is where most cervical cancers begin. These cells are then examined under a microscope. If the results are NILM, it confirms that only normal cells are present. This includes squamous cells from the outer cervix, glandular cells from the cervical canal, and metaphysician cells, which are normal replacement cells in the transformation zone. Having a NILM result is very reassuring. It indicates that there are no signs of precancerous changes or cancer in your cervical cells during that screening. However, it is important to remember that cervical cancer can develop over time. That's why regular screening is essential. Even with a normal result, healthcare providers usually recommend follow-up screening at intervals based on your age and risk factors. It's also worth noting that a NILM result does not mean you are immune to future changes. It simply means that at the time of the test, your cervical cells appeared normal. Continuing routine screening helps catch any changes early, when they are most treatable. In summary, a NILM result in a pap smear is a normal and reassuring finding. It shows no evidence of cervical precancer or cancer at that moment. This aligns with current medical guidelines for cervical cancer screening. Always follow your healthcare provider's advice on screening schedules and discuss any concerns you may have. Remember, staying up to date with your screenings is a key part of maintaining your reproductive health and catching issues early when they are most manageable.